Welcome to Sports Ophthalmology, a podcast for ophthalmologists and trainees interested in providing eye care to athletes. I am your host, Jared Tuttle. Join me as we hear from national leaders in this exciting subfield of ophthalmology.
Hi, everyone. Thank you for tuning in. I'm Evelyn Bassett, your co-host today for Sports Ophthalmology. I hope you're having a great week, and it's about to get even better because we have an amazing guest today on the podcast. We have Dr. Taj Nasser, who is a refractive cataract and anterior segment surgeon at Tylock George Eye Care in Dallas, who has a passion for precision and performance. He earned both his Bachelor of Science and MD from East Carolina University, and then went on to complete his ophthalmology residency at Tulane University in New Orleans, where he served as chief resident. He further specialized in advanced training in refractive and cataract surgery at Parkhurst NuVision in San Antonio. He is driven with a deep interest in optimizing vision for high performers and has had the privilege of working with elite athletes, including players from the Texas Rangers and the FC Dallas. Thanks so much for coming on, Dr. Nasser. Appreciate this. We're really excited to have you.
Thanks, Evelyn. Really excited to be here and excited to talk about this really cool topic.
Thanks so much. So, how did you first get involved in sports ophthalmology, and what drew you to this specialty?
Yeah, for me, it really was serendipity. I didn't really have major plans going into it. And, I've always had a passion about vision and performance and improving the lives of the patients that I take care of. Because that's the reason why I chose to subspecialize in refractive surgery, because we help people see and improve their lifestyle. And I did play sports growing up, specifically only soccer. And so having a sense of understanding how important vision is in elevating an athlete's game. So I moved to Dallas last summer and I took over a well-established practice. So Tylock George, it's been in existence for about 4 decades, who already was in collaboration and, with several teams in the past, most recently with the Texas Rangers. And so it's been super awesome for me to interact with MLB players, and it's just been a pleasure in understanding that, and also performing LASIK on several athletes, including a soccer player. So for me, it's a recent involvement and something that's pretty cool.
Well, that is really cool. It's probably been fun seeing that grow and, taking over that business. So that's really cool to hear about. And
Yeah, thank you.
what key factors would you consider when helping athletes choose the right refractive surgery and IOL?
Yeah, it's really important to evaluate the visual demand based on the sport and their position. For example, a goalkeeper has a very different need than a midfielder in soccer, or in baseball, a batter when they're tracking a fastball, for example. So that's one consideration. Another consideration is their career timeline, and because timing is very important. Are they in season or are they off season? Because that can influence the timing of the procedure. As far as the choice between what kind of procedure do we perform, we have plenty of options, EVO ICL, LASIK, PRK, or other lens-based options. It really hinges on their candidacy. Because as we know, the recovery for EVO ICL or for LASIK is much quicker than PRK. And it's really the preferred approach because these athletes are highly active and they really want to get back on the field and into the game as soon as possible. So really it hinges on their candidacy, their position. There are lots of different factors that come into play when we're taking care of athletes, which we'll talk about in a little bit. Unfortunately, there's a lot of misinformation out there that I realized about LASIK and ICL and the associated safety profiles, when we have lots of evidence in the literature regarding the amazing safety profile and many athletes who've undergone these procedures and really elevated their game. So all of this to say is that these procedures have been studied extensively and have had great success.
Yeah, that makes sense. You mentioned that there's differences that you have to consider between the different players. Would you say different sports have different considerations? I'm curious if there are any similarities or differences
when treating players from different sports?
Yeah, so there's some overlap, for baseball players and something I always talk about. So we went to spring training recently, and there's three different factors. There's the visual acuity, which is important, and one thing we did as far as an education when we're talking to the players is, did you know that the average MLB player's vision is 2013? And that's something that's important to educate because it does impact the contrast sensitivity, which is another portion of vision that's important for an athlete's performance. How do you track a ball in a light background when it's up in the sky and it happens to be cloudy? And depth perception is important. So we also test that when we're looking for players because that impacts their dynamic focusing as well as eye movements. Baseball players really need that, the elite depth perception, the focusing, and because a lot of different movements are involved, so saccadic and smooth pursuits as well for baseball players. So having all of those considerations are important. Other sports may have other factors of vision. A lot of times in the eye field, we mostly think about, okay, Snellen visual acuity. We really don't think about contrast sensitivity and depth perception for the majority of the part. Um, and correcting astigmatism. So we know that astigmatism correction is extremely important because that does impact contrast sensitivity. And so overall, if it's a baseball player or a basketball player who happens to have a lot of indoor lighting and glare that they have to take into consideration, or someone that's involved in swimming or archery, many different factors come into play, and really ensuring that we're correcting athletes' vision to the highest capability and caliber is important because it impacts their every moment that they're on the field and their performance. And so uncorrected refractive error is extremely important. And the hassles of contact lenses or glasses during a game really does pose a significant hurdle for athletes at times. So being able to treat them according to their specific preferences and tailoring the treatment is extremely important.
Yeah, that's a good point to think about all the factors that they might be going through and some of the strengths that they're needing to work on to achieve the highest they can in the sport. So that's really good insight there. And how how can athletes achieve the best possible vision to enhance their performance?
It really starts with their own motivation to be spectacle independent and really not have to deal with glasses either. And the reason I mention this is, I was at spring training with the Texas Rangers recently, and I was talking with some of the MLB players, and it was just very interesting to hear the reluctance to do anything. And a common thing that I would hear was, my eyes got me to the World Series just like they are. And so if it ain't broke, don't fix it. And I don't want you to mess with my eyes. So there's this significant attention to tradition and routine. And so when you have when you're further down the line with your conversation with these athletes, you uncover a lot of their pain points in their daily lives and even during games. So one example is one of the pitchers described how annoying it was to get fogging or sweat, and they've changed the designs of their glasses to help with that issue, but still it's not a fix for that issue. So they would get fogging or sweat. And when you're pitching, you have this quick head turn when you're throwing the ball, and sweat gets on the glasses, or the glasses tend to, push down towards their noses and moves away from their line of vision. And you can imagine as a someone who's pitching, you have to have a very quick reflex and movement. So to be able to get the glasses back to the correct vertex distance so they can see, they would find themselves slapping their face and running at the same time. And we were all laughing about it and saying we were surprised that this particular player didn't give themselves a concussion. But you would think that there would be a willingness to do something about it. But as there's this strong preference to routine, and that's what makes them one of the best athletes in the game. Is it's hard to consider a change. So one of the surprising things for me was, you had really, amazing players that uncorrected, in several sports were not even 2020. I mean, some were 2050, 2060. And so there are these low-hanging fruits for athletes to achieve the best possible vision so that they can enhance their lives. But a lot of it's can be a little bit challenging sometimes to to move beyond that and move beyond the routine and the sense of, okay, everything's great the way it is. I just don't want to change anything. But the more education we do, the more we interact and really build that value proposition, the more we can look beyond that because we have such amazing diagnostics and technology is constantly evolving and we're involved with the latest and greatest. And so we can definitely help players, get back to the field in no time. And sometimes even minor adjustments or minor enhancements can just yield tremendous performance gains. Because some players see 2020, but if they have just a little bit of astigmatism or nearsightedness, getting them beyond 2020 can make a big difference in their game.
Well, that's inspiring to hear about. Uh, what are some unique aspects of refractive surgery for athletes that the usual ophthalmologist might not expect?
So kind of a little bit of what we were just talking about, but also athletes are just extremely in tune with their vision. They can notice subtle issues that, casual patients really might not overlook. And I think one of the other things is the recovery expectations and demands. It's just way elevated, especially during season. There's a time crunch. There's this intense amount of training, and so the pre-op planning, the education, and post-op care really has to be meticulous and well planned, especially with the coordination. Another thing is that, I found myself sometimes, that's unique with athletes is you're not really only treating the actual athlete, but you're also being involved with the trainers and the whole team, because it's almost like the decision for the athlete doesn't only hinge on their personal decision, but they have to take other things into consideration, which is different. So the trainers, the GMs, the whole team has to all be in line regarding the timing, which was interesting to me. And the other unique aspect I would say for athletes in refractive surgery is, how much of a difference it makes to them. An example is I did LASIK on a soccer player a couple of months ago who would wear contacts. So this particular soccer player had quite a bit of astigmatism and would wear contacts. And the main complaint was, I just don't like the way contacts feel on the field when I'm playing. And there was an instance where the contact just popped out of my eye in the middle of the game. And you can imagine that just ruins the whole game for this particular athlete. And not to mention, the risk of infection with contact lenses we know is higher compared to laser vision correction. So things like that are very unique that sometimes we don't think about that, if a contact lens pops out in the middle of the game and, the player is really dependent on spotting the ball from, very long distance, that could definitely ruin the game for them, which is a big deal.
Definitely. What are some of the day-to-day responsibilities of working for a team as an ophthalmologist?
Yeah, so it's being a team ophthalmologist isn't just about performing surgeries, which, is very gratifying. It's also being integrated to the whole team. So where you're able to get involved with training seasons, going to the games, and it's not just doing the surgeries, but also routine vision screenings, preseason evaluations, training consults, and then, the general ophthalmology concerns such as dry eye, talking about, because, for instance, in baseball, being out in the field quite a bit during the day, the players' eyes can get really dry. And so talking about managing that as well with all the players. And also, sometimes just urgent issues that come up. I was at spring training and you'd have, a lid bump or something, or a sty or minor inflammation that we would treat. And so the role requires, I would say, just a collaboration, really good communication with the trainers and the players, availability, and having a general ophthalmology kind of background, and being able to feel comfortable treating a little bit of everything is important. And so that kind of sums up the day-to-day responsibilities, and especially during the training season. When we're on season, it's very hard to perform many of the surgeries because, the players are just so busy. But the off season is usually the time when we can talk about, enhancing the performance.
Oh, that's cool to hear about. And yeah, we're wishing you good luck with that. And um, it's fun to watch you keep growing in the business. And so,
Yeah. Thank you.
yeah,
No, it's all really new and cool over the past year, and I'm really, getting to learn a lot about sports ophthalmology that I didn't really have much of a background before. So it's been pretty gratifying.
yeah, definitely. It's a cool field. And like you said, a lot of room for growing that like kind of margin of difference in the visual acuity. So, yeah, really inspiring. And what would you say your favorite things are about being a sports ophthalmologist?
Yeah, for me, it's we don't really learn about this niche during residency. Sports ophthalmology isn't really discussed at in thorough kind of detail. So for me, it's like learning this other kind of niche. That's one of the reasons why I wanted to do refractive surgery, was to just subspecialize and really understand the nuances of refractive surgery. Sports ophthalmology and the nuances that come into play when taking care of athletes is very intriguing to me. So the nerdy aspects of vision and understanding, contrast sensitivity and depth perception and saccadic and smooth pursuit movements, and how those fine details are actually much more important than I thought. So that kind of that kind of new kind of nuanced information to me was exciting.
Yeah, definitely very exciting and excited to see how that keeps growing. And would you say there's any challenges of being a sports ophthalmologist that you've faced, or what are some of the challenges you've
Yeah.
noticed?
Yeah, so as far as challenges, I would say the timing. I think that's one of the biggest things. These athletes have rigorous training regimens, just intense travel schedules. I recently did one of the Texas Rangers coaches surgery, and we implanted the light adjustable lens. And this particular lens technology, you have to have a lot of post-ops, more so than the typical routine post-ops after cataract surgery. And they have to wear specific UV blocking glasses, and trying to find specific windows, especially during season. So we happen to do it during season, and which makes it a little bit challenging. So the timing and the careful coordination, because getting them back to full recovery is one of the highest priorities. You really want to avoid disrupting their performance timeline. And so lots of planning ahead, sometimes unconventional hours to meet the demands is extremely important. And I would say there's also this underlying pressure to be perfect. Refractive surgery is already, there's very little room for error, subspecialty. And then taking care of athletes and the team is also high stakes. These are individuals that are elite athletes, and it's not just about clarity for them. It's about, competitive edge, and the little margin of error, I think, and the expectations that can be pretty, high. It can be a little bit challenging at times, but I love that pressure. I love that high standard of care, because it really pushes our team to just be much better, and every day that we're doing this. And that's part of the challenges. And I think for us, it's really part of why we love what we do. I can tell you one of the most rewarding aspects seeing the athletes perform. So meeting them at spring training, and getting to know them and checking their vision and doing the vision screenings and talking to them about all the statistics and data, about the spin of the ball, and how their eyes work, and hearing feedback from them about the nuances. and then literally like an hour later seeing them on the field, and it was just really cool. It's a unique privilege to be part of, the athlete circle, and then having the sense that, okay, I in some little way contributed to their performance on the field, which is awesome.
Definitely big contribution to the performance, and I bet it's fun as you have different players you're working on and seeing the whole cohesive team kind of come together, and you can take a look at this player or that player, and you just sort of have a sense of, feeling like you're taking care of the whole entity too. So that's really nice.
Yeah, it's awesome. So I went with my family to a game last weekend, and it's cool because you're sitting there, you're watching the game, and then you recall conversations you had while they're pitching or while they're batting, and it's really cool. So we're just talking to, we have a 10-year-old daughter, and she's like, wow, one of the players happened to hit a home run. I'm like, oh, I remember I talked to this player about this and this and that, and it was just so cool to have that, really awesome connection that you have with the players.
Yeah, definitely. I'm curious about how a contract with a team works. Like, what does a contract entail, and does it extend to caring for their family members or affiliates or the staff?
Yes, it often goes beyond just the athletes. So, we'll do a surgery for one of the athletes, and it's not uncommon that we end up, seeing their spouses or their family members or their coaches, personnel within the team. And that's one of the really cool parts of this role is you get to provide continuity of care for the whole, ecosystem surrounding the team. So it builds a sense of community for us. And even within the culture of our practice at Tylock, where, every Friday is casual Friday for us, where we wear Rangers gear. And, we have our annual Rangers event where, for our staff, we go to a Rangers game together, and really deepens the sense of community and culture within our team, and also within the collaboration we have with the Rangers. So it's much more holistic to not only the athletes, but to the whole team that's involved surrounding the athletes.
That makes sense. And how long does like a contract last, or how does that work?
That's a great question. It's dependent on the sport, and it can range between a couple of years to 5, 6, 7, 8 years. It really depends. Every contract is different. Every team is different. But usually multiple years of a contract, and it's a typical agreement between the team and then the sponsor organization, which would be us. And then every team has sponsors from many different subspecialties. So we're the LASIK providers for the Texas Rangers, but then they have several different sponsors. So when I was at spring training, we were interacting with their dermatologist team and their orthopedic team, and so it's that's the overall general structure of the partnership.
That's a good point. And I was reading how there's like the electronic records are special too, even for doctors involved. Is that something you deal with for the LASIK, or
Well, not us per se. So our collaboration is a partner, kind of a sponsorship collaboration. And so I'm not integrated into the specific EMR. So we see them at our clinic with our own EMR. So it's not an integrated EMR within their team system for my situation specifically, but that is definitely a possibility I could see with other setups and how it may work. But overall, it's a really great collaboration to be involved, and also from a marketing and branding perspective as well. It's really nice to be a practice that's affiliated with the Texas Rangers, and because who doesn't like the Texas Rangers in
yeah,
Dallas? And it's been really cool and beneficial for our practice as well.
yeah, definitely. They're champions, and a great team. So that's so fun. You all have the Friday you celebrate, and it's really good. A really good environment you guys have.
Yeah, for sure. We try our best to do that.
So, for someone who's interested in becoming a team ophthalmologist, what advice would you give them?
First and foremost, I would say to get really good at what you do. So whatever subspecialty you're in. So for my situation, refractive surgery and anterior segment care, it's very important that you're well trained. And so I had the privilege of having subspecialty training in San Antonio with Greg Parkhurst, and it was really nice to hone my skills. And so I was there for actually 2 years, and each year we get to do, 3,000 procedures. And so honing in your skills and being really good at what you do is important, because, athletes want solutions that are very precise, fast recovering, and, predictable. So it's really crucial. I would also say, the team values, communication, professionalism, you really want to be someone that they can count on and that's available. For someone who's trying to get involved, networking is very important. Building relationships with the local doctors, with sports medicine physicians, even athletic trainers, attending the sports meetings, also volunteering could be helpful as well. And then you just never know what kind of opportunity presents to you. So the um, the soccer player that I happened to do, we collaborated, we were in touch. I got invited to um, the FC Dallas, where I got to meet some of his coaches, and one conversation to another, and already we were discussing a potential collaboration. So you never know what door's going to open. Just seeking those opportunities, and then word really travels. So after I did that first soccer player, the coach reached out to me. He was like, "Hey, I saw how amazing of an outcome that individual player had. I really want you to consider this other player." So it's that word of mouth is also very important.
That's great advice. Thank you. And how do you see the world of sports ophthalmology evolving in the next, 10 years or so?
It's a great question. I wish I had a crystal ball to know where the field is going in general, because there's so many ups and downs that we're constantly involved in. But I think more so, vision might be integrated more and more. One thing that I noticed at training was there was a focus of research within the actual group where, nutrition, strength training, and, the idea of visual performance would be very interesting to see, aside from, stereopsis, contrast sensitivity, the things that we talked about. And I think one thing that will propel it is the the adoption of AI. I think artificial intelligence is definitely going to be a game changer. So, we have diagnostics for corneal changes, and what if we had predictive analytics based on eye tracking during a gameplay, for instance, and having that access to technology that's able to analyze data way more robustly than before is going to propel the field forward. So I think artificial intelligence is gonna play a big role in surgical planning and recovery prediction, especially for athletes. And I think we're just scratching the surface. So the role we have as eye surgeons and refractive surgeons is really well poised beyond the clinic. I think we can be more integrated into training centers, into performance labs, and into the field as well. So what could happen, and is continually evolving and only getting more is very exciting to see.
Yeah, that's very exciting. I can't wait to see some of that in action. All right, well, last question. What's your favorite sport?
I'd have to say soccer. That's always had a special place in my heart. I grew up playing quite a bit of it. I was always the defender, the skinny tall dude in the back. And that taught me a lot about teamwork and discipline, and also I would say quick decision making. So when you're on the field, you're thinking on your feet, pun intended, and all of that has really just just are things that I took with me in my surgical career. And so now that I've had the chance to take care of athletes and, baseball players and, soccer players, it's really surreal in a way because it's almost like a full circle moment for me. And so soccer has always had a special place in my heart. That said, I've really developed a liking and love for baseball as well. It's the intricacies that go with it, especially working with the Texas Rangers, has been pretty interesting to me. Getting to meet the players and recently seeing them at games and season, and knowing that I'm able to play a very small part in supporting the players and coaches has been pretty awesome. So I've grown the love for baseball as well.
That's great. Yes. Well, thanks so much for joining us and all of your advice. And we're so excited to watch you keep growing in this field. And um, yeah, we're rooting on the Rangers and the FC Dallas. So thanks again for joining.
Thank you for having me, Evelyn. And you guys are doing such a great job with this podcast. And I can't wait to follow your journey and the amazing things you're going to do. And hope to see you as a sports ophthalmologist one day.
Thank you so much. I appreciate that. All right. Well, thanks so much for everyone, and thanks for everyone joining in, and have a great rest of your day.